I think we may as well get started. And like I said, I'm sure some other people will jump in as they become available. We'll ask them to introduce themselves at the end.
Shall I?
Yes, please.
Okay, thank you. So if it's all right, Doc, I'm gonna share my screen in a moment, but I guess in the beginning, I want to say thank you, and I look forward to being of some degree of enlightenment here and of help here moving forward. I wish you all well, as I've told Corey before when we met, and also, over some time over email, and now again this afternoon. It's a difficult time, a time of crisis. It's also a time for the best of mental health practitioners to work together and really take this opportunity to both heal and maybe educate along the way so that we can not keep putting out fires. And so I'm happy to be of service to you all and explaining a little bit about lithium in a different way. So looking at lithium in a very different way, which I wasn't privy to. And I have partially figured out and partially, on the shoulders of many giants, learned something that really wasn't taught. So now I'm going to share my screen. We're going to go through some of these slides. Hang on. Sorry, here we go. Quickly. There we go. Okay, so you see that now? Everyone see that fair? Great. So Genesis to wellness, I'm trying to introduce these words. They're part sacred and part secular, right? And the place I want to start with is the Big Bang. Okay, we're not going to cover all of history, but lithium is detectable still at the Big Bang, and it's relevant because there's hydrogen, helium, and lithium. Only one out of those three is a solid. So it is the metal, it is the salt, it is the solid that the dynamite that ignited uh, the known universe, right? So there's actually a nice TED talk. You're welcome to look that up in terms of the physics of lithium, and there's a lot of poetry surrounding that element. Now, this is a screenshot of a great article from NASA, but the title says it all, which is that where most of lithium is detected by NASA, even now, uh, it comes from exploding stars. That when you are looking into the universe and when they're looking with these telescopes and measuring certain elements to detect the presence of viability in terms of other suns, they're looking at the amount of lithium that is burned. So again, more poetry before we get to some of the pragmatism. Here's our favorite periodic table, and it is the third element, right? We look at hydrogen, helium, and then lithium right above sodium, potassium, magnesium, calcium in that same row. So some of these other elements we know very well as medically and from health, right, from bio 101, from the most rudimentary understandings, that these are necessary elements. And even the World Health Organization has called lithium an essential trace element. And now from there to Texas. This is a map of heavy lithium concentration in groundwater in Texas. This is an article out of Texas A&M, about 10 years old, and doesn't mean there's a lot of lithium. It means that there's just the right amount. And I'll explain to you that if you've had Pellegrino has about 200 micrograms of lithium per liter. Okay, so you get 5 liters, you get 1 milligram. Okay, the amount that is in Big Bend, Texas, that you see there north of El Paso, where it's dark, is approximately half of what is in Pellegrino. Okay, and coincidentally, in those areas, there is very low rates of suicide and homicide and even crime rates. This is what this article looked at throughout the state of Texas. And there's no shortage, as we know, of guns in Texas. There is a shortage of mental health care. So it's remarkable that the presence of this element within water that people are drinking had such a remarkable effect. Imagine if there was other more enlightened practices in terms of healthcare and gun regulation, Texas could be truly a lone star. Uh, we are going to get to clinical pragmatics. This is 7 Up. 7 Up was created around the same time as Coca-Cola. So about 100 years ago, there were at least 100 different bottled waters, as you can see at the bottom of that slide. Other bottled waters, some from Saratoga, upstate, from Athens, Georgia, from around the country and around the world that were lithiated waters. The first bottled waters were lithiated waters. And so, piggybacking on the success of so many different brands, a pharmacist, a chemist came up with 7 Up after some failed beverage attempts. But this, thanks to his wife and him, was a really tasty and still surviving drink, though it doesn't have lithium in it anymore. The atomic mass of lithium, by the way, is 6.9, and it makes you feel up, right? So we think about lithium normally as a bipolar medication. That dosing for bipolar is about, on average, 150 times what is in water, what is in nutritional lithium. Okay. So this from the Tampa Bay Times, we know of Ponce de Leon and the fountain of youth, so to speak. But when he talked about, well, this place is wonderful, St. Petersburg, Florida, this is the place for me, etc. They recently measured there is actual lithium deposits in that area where, so-called fountain of youth was. So broadly, where I'm starting is that within the physics and within the earth, when you look at lithium as a natural trace nutritional element, there is consistent association historically in it being useful. Okay, now that's not evidence-based science just yet, but it cannot be ignored. All right, we're going to get to some more of that. Now, in terms of bipolar, again, the amount that we're talking about, there's different forms of lithium. In bipolar, we use lithium carbonate, approximately 600, 1200 milligrams dosing per day. More is problematic, and we wouldn't do that. And even at 6 to 1200, you want to measure lithium levels, thyroid, CBC, blood levels, chemistry, EKGs. There's an array of things you want to look at to ensure that this is being tolerated well. Okay. But in those doses, it is verifiably replicated studies, the best treatment for bipolar disorder. Fewest manic episodes, fewest depressive episodes, most brain health, fewest episodes of suicidality, least suicide completion, right? So all of that, if we get the dose right, if we get it tolerated just right for a patient, it is still the best treatment for bipolar, and yet it is underutilized, probably because of an array of market forces and miseducation. Let's just put it that way. Now, when we look at it at that level, lithium carbonate is about 150 times what is in the ground. Okay, now this lecture is really about this range of low dose lithium. What is low dose lithium and what is microdose lithium? Okay, technically, low dose is anything below bipolar dosing, and microdose is what you can pretty much get over the counter, right? Or within natural soil and water. So you can go live in Italy, you can live in the Mediterranean, Champagne, France, Baden-Baden, Germany, even some places in New Mexico, and as I showed you, Texas, and you can get that nutritional 1%. So I'm going to tell you about some benefits of that. And then as a clinical psychologist, the weapons that you may have are very much skills level, interpretation level, supportive level treatment, cognitive behavioral level treatment. I think that to have and know that this weapon exists, it can give you potentially an avenue to share with your patients, to share with their providers, to say, hey, listen, this intractable suicidality, inflammation, depressive disorder, dementia, there is something called low dose lithium. We don't always have to just jump to psilocybin, ketamine, and very or THC or things that are a little less historically and clinically proven. This is out of the New York Times, and it discusses how powerful lithium can be when used correctly by patients with bipolar disorder. This is out of the Green Journal, and again, just showing the top journal of the American Psychiatric Association. That even here, they've written about the benefits of lithium and even Depakote, but in this article, it breaks down that one is definitely better than the other. Lithium is natural. Depakote is not. Lithium is going to lift you, whereas Depakote is an anti-epileptic. It's very different on the brain in terms of how it affects it, and I'll get into that later. Again, from the New York Times, and this from Dr. Fells talked about, well, is this a viable solution for us all to take a little bit of lithium? Because if it's in the water and people benefit from it, is that drugging them, or is that actually enhancing their health? And the more we look at it, the more we see that other elements on the periodic table right below it, the right amount of sodium, magnesium, potassium, calcium, when it is in water, it enhances not just the taste, but the benefits of water. You strip away all those minerals and you get distilled water. It tastes horrible, but there's no ability for charge to live within that water, for cells to move ions across membranes, because we are in fact electrical beings. So the lithium that is charging this phone and your devices, when it's in ourselves in the right amount, we do have approximately 7 milligrams of lithium in each of us. When it's added, it further enhances an array of processes. So this is an excellent piece from the Journal of Mineral Research talking about lithium as a nutrient. And of course, I can send this PDF to you all so that you can dive into each of these articles and editorials with a little bit more detail. Now, this, if you can see it, great, but I will also send you that. You could certainly see the, excuse me, boy. There we go. The array of emojis in terms of cognitive health, immune health, cardiac health, musculoskeletal bone health, and inflammatory modulation, right? So the top article, which is without a gate, you can get this, without a fee. If you look up the term low dose lithium on either Google or PubMed, you will see that it's a meta review out of Canada. So again, a place with the national health system, no bone to pick in terms of influential reporting. But this is a meta review about the non-psychiatric benefits of low-dose lithium supplementation. Here it is. It's one of my favorite articles to share and show to my patients that, a small amount of this, either over the counter, but especially the prescribed low-dose lithium, is very powerful in an array of processes synergistically with what you already take, and potentially can lead to substitution of what you take, specifically benzodiazepines, antidepressant excess, antipsychotic excess, polypharmacy. This is that article. This is something I wrote and published in a peer-reviewed journal, and I'll briefly go through this. This is the effects of what happens when you supplement addiction treatment with low-dose lithium, right? So I'm an addiction treatment medical director at the Center for Recovery and Wellness, downtown New York. And we obviously have a very diverse and severely ill at times and indigent and uh, significantly medically ill, recidivistic, all of these words, and yes, motivated as well population. So when I got there, I said to the team, I said, look, you guys do a great job. You have an array of supportive elements in terms of housing and vocation and DBT and therapy and food and uh, you know a safe setting, but we're still using very basic approaches to treating addiction. We are simply providing the BALM for uh, withdrawal. So we're using a great amount of Suboxone, but we're not dealing with causes. We're not looking at medical causes. We're not looking at emotional causes in depth. And we're not using, tools to look at economic or ADHD as a cause. So let's look at some of these underlying causes and let me enhance health with certain supplements, from vitamins to using low dose lithium to offset the damage from drugs. They said, fine, let's do it. And what we saw after a year is we looked at the data retrospectively, and the patients that took this approach, the low dose lithium approach, had double the rates of completion, half the rates of relapse. Polypharmacy came down, benzodiazepine use went to near zero, health improved. So there's a lot of benefits that we saw, akin to adding iodine into salt, akin to adding fluoride into the diet up to a certain point. So in addiction, that's how we've now become very well known in New York State. Oasis has rated us within the top 1%. It's mainly because of this holistic approach, but this magic salt had a lot to do with it. GSK3. If people ask others, well, how does lithium work? Some people say we don't know, but really now we know. And psychiatrists should be able to say, these three letters, GSK and three, not GlaxoSmithKline, right? But glycogen synthetase kinase. This is a major aging enzyme, and there are about 100 known substrates, things that are affected by this enzyme, all the way down from how well you sleep over time to apoptosis, whether your cells are programmed to die at specific times, to telomere length, to inflammatory cytokines, uh, to cardiac health. There's a great deal in this article, but I think if you want to look this up, another way to look at it is when we are older, when we have brain damage, when we have addiction or concussions or illness, mental illness, GSK3 goes up. This enzyme prunes neurons. It leads to brain death. So if you're inhibiting, like lithium does, this enzyme, you are prolonging brain health. And as a result, less inflammation throughout the body. So it is a shield, as close as you can get to that. All right, next we have more on GSK3 and the connection here to CTE, right? So we've got the Buffalo Bills right up there, and we've seen, every week you watch the NFL, it's a visible situation that is very graphic and awful, but we don't see the unseen harm that football can do. There's certainly ways to measure it, which they're not taking. There's certainly ways to manage it post, pre, some of which they are taking, but I hope they'll be able to listen to even the individual who coined that term, Dr. Bennett Omalu, who was played by Will Smith in Concussion. He has mentioned the benefit of using low dose lithium in concussion mitigation. So if you all see and maybe speak with families that have kids that have had a recent concussion some way or another, accidents and injuries, I think this is a fair and data tested and vetted system. I certainly, if my son or my daughter uh, went through something like this, I would offer them a course of over-the-counter concept low dose lithium. Yes, more on TBI and more on TBI, more on CTE. This is something I created, and it is, you know, there's a minor plug in this, and I don't want to say too much about third element water, but the version of lithium that is over the counter, you can get in many different ways. You can look up, when you do look up low dose lithium, you're going to see, products that are from vetted sources out west in California, that are just lithium orotate, which you can take. And about 23 milligrams of lithium orotate equals the amount that you need per day, which is 1 milligram of elemental lithium. There's no product that has that except this. And the other vitamins that we're frequently missing, from specifically vitamin C, D, B, calcium, iron, iodine, magnesium, and potassium, in that order, we are deficient in, according to the CDC, is also in this powder packet. Cancer. I didn't really mention that earlier, but this is an excellent article, and this is connected to GSK3, that there is anti-cancer properties to including lithium in your diet, in a supplement regimen, and God forbid, during treatment. There's already data about, lithium and uh, offsetting chemo brain, right? Chemo brain is a cute way to say the brain death connected to chemotherapy, right? And so if we want to preserve more brain, this is really that mother element to do that. HIV, an important consideration because it's, still without a vaccine, uh, chronically manageable, and it's a virus. Okay, so when I used to work at uh, the Bailey House, which is up in Harlem, I saw a lot of patients with HIV, and I spoke to them and I said, look, let's obviously do what you're doing. Let's measure your CD4 count. Let's look at your viral load. Let's, continue to be safe and as much as we can and stay adherent. But you should know that when you add low dose lithium, 150 milligrams of lithium carbonate, right, which is about 1/7 or 1/9 of what bipolar patients would take. If you take this, there's not going to be side effects, but there will be an elevation in your CD4 count and a reduction in your viral load. There's already been studies on that. And it can synergize with your Atripla, your Biktarvy. So to add this is beneficial for patients with HIV. And then you can also look at HSV, right, or VZV, other viruses that are reduced because of the immune balancing properties of HIV. And speaking of the COVID virus, so when COVID struck, I was obviously still and still am the medical director downtown, and we didn't have a virus, a vaccine. But what I did know is that, look, we need to encourage health as much as possible, encourage protection as much as possible. So masks, valid, uh, and distancing, and also let's stop smoking, guys, because being a smoker is going to elevate your risk of a negative outcome if you pick this up somewhere. Let's, get as de-inflamed as possible. And this is another place to look at making sure that we're using our supplemental vitamin C, vitamin D, and others that I mentioned, and low dose lithium, because in vitro studies showed well before, from a decade ago, that the SARS-CoV virus 1 responded to lithium in in a negative manner, in a direct manner. So we published this from Spain, double-blind RCT. The patients that had severe COVID were grouped into two, all hospitalized. Okay. One group got the supportive standard therapies, the other group got standard supportive therapies plus lithium, plus the course at higher doses. All of those people on lithium were discharged within 7 days, quite unlike the other group. Okay, mixed bag, two mortalities. Many people went to ICUs, an awful scenario, which was global more or less. And this was at a top academic medical center in Spain. Now, the lithium group, we looked at all 18 cytokines. Remember the cytokine storm? Well, all 18 cytokines that we measured were dialed down every time we dosed lithium. And this was double-blind RCT, so no one knew what they were getting. This goes to show that something like long COVID, something like a viral illness, there is important anti-inflammatory properties to using lithium, but cautiously, obviously, at higher doses. But if you ask me, if I'm in a hospital with the flu or with COVID or with a viral illness that is only partially responding to the pharma that is designed for that, then adding something like vitamin D, C, and low-dose lithium is a no-brainer. And now, University of Buffalo. Gosh, his name escapes me, but it will come back to me. It's right here. It's in there somewhere. Starts with a G. But anyway, a great neurologist up there is looking at this in terms of benefits of using low-dose lithium in long COVID. And I have too. I've continued to treat patients that come to me with long COVID, and within 6 months, we're looking at their HRV, heart rate variability, their REM sleep, their cytokines, their overall functioning, their sleep patterns, and eventually I don't see them anymore. Eventually they go down to the over-the-counter version, because by using it, we're able to improve the evacuation, more or less, of the virus and the de-inflammation of the entire system. I'm going to skip that. Let's see, what does that say? Whoops. Sorry, guys. You know what? We're just going to skip that. Forgive me. This is important. We're almost towards the end here. I'm in the military. I'm a Navy commander in the reserves. And, one of the reasons for joining was the effects of service and stress on our military today. I think you all probably know that the amount of servicemen and women that are dying by suicide is greater than combat, and that has been a trend that has increased over the last 20 years, and it's brutal. It speaks to a lot of different things, but one way that we can improve this is with improving their resilience from a wellness end, no pun intended, right? From water versus alcohol, processed food, and just a culture of avoiding mental health and really leaning into physical health rather than seeing them both as things to enhance resilience in many ways. Here's more, about all-cause mortality in terms of lithium. So, I've tried to hopefully introduce that lithium is powerful in the micro and nutritional dose realm, that it's a tool to be used, that it can be prescribed in the low dose range, and that it improves many different causes of death. More about drinking water. And again, one of the important meta reviews of suicide, this is a little bit older, but one just came out last week. Forgive me, I didn't put that slide in here. It's from Nature, and it looked at microbiome, AI, genetic expressions, and it looked at interventions in terms of over-the-counter, but they didn't look at low-dose lithium and prescription. And among the things that they looked at over-the-counter, just for your knowledge, fish oil was very high in terms of improving mental health. And on the other side, lithium was far and away the number one intervention for reducing suicide and the expression in micro amounts of a lot of those categories. Alzheimer's. Okay, so we're obviously seeing a lot of people to evaluate, and GSK3 is connected here, sleep is connected here in terms of debris and the accumulation of it. Now we know about ApoE recently, and the ability for us to look at this gene and know that you either have one or two copies and how that affects the expression of this illness. We know of one absolute intervention that reduces the expression of ApoE, that is exercise. Okay, the other known intervention that reduces ApoE is lithium. That's it. So imagine those two together. And by the way, I take the low dose lithium pharmaceutical version myself, especially on workout days or days where I'm fighting a cold or Fridays or jet lag or maybe even a few days in a row on a tough week. But knowing this, you don't have to get this prescribed necessarily. You can look at lithium rich foods or supplements. This would be, you know, not something that would make you bulletproof, but I think we could use as much wind in our backs as possible. Another one in terms of lithium and Alzheimer's and ApoE, as I mentioned. Again, finally, the second to last slide, it's performance enhancing. Now, when we looked at running, this is out of horses. Okay, so I'll give you two quick examples here that I mentioned. You've got lithium in you, about 7 milligrams. Every mammal, every living sentient mammal on Earth and rock has lithium in it. The word is lithos, which means of rock, from rock. So the ones that they looked at, the horses that looked at in this study, the ones that were faster had more lithium within them, right, through hair sampling. The same applies in a study of Division One track athletes. The faster ones had a higher amount of lithium. Now, the degree was at least one standard deviation over, right? So they weren't bipolar patients, right? They weren't measurably level higher from blood. This was incrementally higher. When it's lower, not only is there a deficiency of performance physically, but mentally too. And these studies have also been done in terms of looking at the lithium levels innately of people in prison, and they have a lower level of lithium. Now, partially that is, epigenetics, partially that is socioeconomic care and diet and such. But getting that corrected is performance enhancing. It's also avoiding, illness, as I've shown, and potential behavioral aspects that are not ideal. All right. So, in terms of third element, these are the things that we want to keep in mind, at least, the folks and I that try to educate people about uh, lithium and this brand, but I think it applies to the rest of medicine as well. And so I think that I wanted to do that pretty briefly. I hope that was brief enough. And now hopefully we can all chat and I will stop sharing. There we go.
That was awesome. Thank you so much, Dr. Gat.
Thank you.
So I've got a bunch of scribbles down here
Yeah.
of questions, but I don't want to jump the line. Does anybody want to start out with any questions?
I would love to start out with some questions. Thank you so much for joining us. First of all, I had gotten interested in this subject and doing some reading. Number one, because I live in Albany, New York, and the sun doesn't shine after November, and I'm always looking for a way to boost my mood a bit. But also when I started reading about anti-aging properties and aging brain properties of lithium, low-dose lithium, one of the things I even bought a bottle. So I got a bottle sitting on my counter. My question for you, one of the things I saw though was that there might be interactive effects with ACE inhibitors, which I am on, and also medications like Advil. Is there any issue with low dose or microdosing and toxicity?
No,
Excellent.
you would have to, the amount that would interact with those two, frequently used medications, Jay, is again about 200 times what you're going to get over the counter. Okay, so you probably bought some lithium orotate. Maybe
Yes.
it's 10, 5 milligrams. Maybe it's 25 milligrams. That's the highest you could buy. Uh, that is equal, 25 or 23 is equal to 1 milligram of elemental lithium. And as again, I told you that the amount that patients with bipolar take is on average 150 times higher than that.
Mhm.
So you're not gonna eat all, even if you ate all 30 of those, it's you'd be sick. You'd probably throw up, but you would not reach anything close to what bipolar patients would take every day. Uh, and so you're very safe. There's another toxic concern, right? And that is pregnancy. Now, oddly enough, there's been no study that has ever shown that the anomaly called Epstein's anomaly, which is a heart abnormality, usually increased by 1 in 1,000 to 2 in 1,000 when you take high dose lithium. So when a pregnant woman who has bipolar takes high dose lithium, that goes from 1 to 2 in 1,000. Still a significant risk, and we want to avoid it, but there's a high risk of what happens to a body that is in mania or depression uh, in in that phase as well, right? But there's no data ever to show that a pregnant woman who took low dose lithium would ever have that or ever did get it. And at the same time, I would recommend to her or that person that we want to avoid this as well. So many of my female patients, when they get pregnant, I say, well, we want to pause this, okay, at least for the first trimester, and give you as much support as possible. And if we need to restart it or ever you need it, you can take it, but we want to try and avoid it. So that's the real place that I discuss mostly: thyroid illness, kidney interactions. This is all moot when it comes to low dose lithium. It's not even measurable. So in the paper that I published, we looked at all of those parameters and we looked at lithium levels. It was always zero because you can't measure it unless you do an elemental hair analysis. But all of those other parameters were unchanged, if not better. There is data now to indicate that when you take low dose lithium, your autoimmune components improve. And so your kidney function actually improves versus the other way.
Gotcha. So if somebody's taking lithium orotate, how much would you recommend they take or build up to? How would one approach that wisely?
Yeah, I would urge them to build up to about 20 if they can tolerate that.
Okay.
And sometimes there are impurities. That's the thing with over-the-counter supplements, is that there's no regulation, right? So
Yeah.
you can have sawdust plus. That's why I created my own. So I could say, look, I make this in Minnesota. I know what this is. I take this. The United Kingdom polo team takes this. The horses too. Okay. The New York Knicks take this. Okay. But I know what's in this, but if anyone looks at this over the counter, I say you want to aim for about 20 milligrams of orotate, but you can gradually dial up. In terms of foods, worth mentioning, the soil erosion is a real thing, unless you're going to really special farmers markets. So even if you got great California pistachios, which are rich in lithium, and a lot of nuts are, um, that's no pun intended. Okay. Uh, you know, the amount that you need is significant, but the Mediterranean diet, okay, it's as simple as that, right? If we have fruits, nuts, vegetables, root vegetables, fish, small fish, and bottled mineral water, that's probably the way to do it. And the
If
region
somebody
matters.
wants, okay,
Yeah,
gotcha. If somebody wants to purchase your version of the supplement, that's prescription only, or that is you can buy that over the counter?
you can. That's at
Okay.
thirdelementwater.com. Yeah.
Okay.
Now the
Thank you.
prescription version, if you got a hold of a provider and said, hey, by the way, I heard about low dose lithium. This client might benefit from it. They've tried the over the counter version and they've tolerated it, but we're not seeing benefits. The amount that's different is approximately 10x. Okay, so if I prescribed you 150 milligrams of lithium carbonate to CVS, it would cost like $4, by the way. which is ridiculous, right? And that amount is equal to approximately 10-ish packets, or about 10 milligrams of elemental lithium.
Thank you.
I have a question. First of all, we're past 12:45, so I asked everybody to set that aside. So if anybody needs to drop off at this point, thank you very much for joining. I think we're going to hang out for a little while longer. If you want to say, I met with somebody.
I just want to say thank you, Doctor. I will have to drop off. Thank you. I learned a lot. Thank you very much.
Bye, Mark.
Bye.
I met with somebody last week who's works with patients, ketamine, therapy, and they were explaining to me how that works in terms of bringing about sort of an emotional rearrangement, kind of a paradigm shift, for the patient. To me, it sounded almost like like a spiritual realignment. So I think conceptually I understand the effects and how that could work. What I understand statistically what you're talking about in terms of low dose lithium, but when you're working with somebody who is bipolar, depressed, addicted, what is the actual effect that they experience that leads to these outcomes? Is it just an improved sense of well-being? Like what is the effect that they experience?
It's more light. It's more hope. It's as simple as I can put it. So there's less of the rumination in the negative, dark thinking, right? The hopelessness is a precursor to thinking about ending your life. And then the impulsivity and means make it more likely, right? So what lithium does is that it improves that space by, if I could say it poetically, right, creating light within. Now, on a molecular level, it is reducing inflammation in the brain, right, by suspending, I wouldn't say suspending, but reducing the expression of GSK3 is reducing inflammation. So the same way that if you had ice on a swollen ankle, then that led to better functioning afterwards. That's what this is. It's reducing inflammation inside out. And sometimes we need a little bit more, depending on, well, bipolar would be very different, right, than unipolar depression, anxiety. So that's why I've looked at the scale, and I think it's a weapon that psychiatry misses, because if you're not bipolar, they won't even look at lithium. They don't understand that there is a low dose range. They also don't understand that there's a low dose range of clozapine, which is a very powerful and effective antipsychotic. And they are just beginning to get the grips on ketamine, which was number 3 in that Nature article. That by using that is also a powerful anesthetic, but also anti-inflammatory. So we want to look at what is data-driven in terms of improving inflammation in the brain and find the right amount for each person gently. Because if you just give SSRIs and you're throwing darts at times, you don't get the best results.
Excellent. Any other questions, guys? All right. Well, thank you so much, Dr. Gatt. That was awesome. I'm going to stop the video. Oops, that's my own video. Okay. Well, I'll figure it out later.
There you go.
But I do thank you for being generous with your time. That was really super interesting and enjoyable. And I'll again pass out your contact information to the folks on our team so that they can follow up with you if they have any other questions or if they want to connect for any reason.
Absolutely.
Thank you. Pleasure speaking with you all.
All right.
Thank you so much.
Bye.
Bye-bye.